Good afternoon. Thank you for joining us today as we celebrate a milestone in our community's history. I'm Mandy Hauser, Chairman of the Atrium Health Foundation Board of Advisors. Today, we're gathered to announce exciting plans that will impact the future of Atrium Health and the patients we serve. We're rolling out what has been several years in the making, a comprehensive philanthropic campaign to help transform how we deliver care. Having lived in the Charlotte region for 30 years, I've had the privilege to see the unwavering commitment Atrium Health has had to caring for people from all walks of life. So it comes as no surprise to me that we are taking that to the next level, embracing a 6-year campaign that is dedicated to our mission of bringing health, hope, and healing to all. Leading up to today, so many have already stepped forward to offer their support. We are so grateful to all the individuals, family foundations, local and national corporations, and others who have helped us get to this point. Personally, my family and I continue to make this health system a philanthropic priority as we have experienced firsthand the life-saving care Atrium Health has to offer. In the next half hour, you'll hear more from Atrium Health executives, campaign leadership, and community advocates, all sharing how we are elevating hope through this bold new campaign. And now, to help us kick off this campaign, I'd like to introduce Gene Woods, President and CEO of Atrium Health.
Good afternoon, everyone. Thank you for joining us as we reach yet another milestone in our Atrium Health storybook. Coming off the heels of quite a challenging year battling the pandemic, thanks to the grit, the determination, the compassion, and the ingenuity of our teammates, we have a lot to celebrate here today. From big accomplishments like launching our hospital at home program to extend our virtual services into our rural communities, to distributing over 3 million masks to our most vulnerable populations, and providing over 600,000 vaccine shots in the arms of our community members, to bold endeavors like opening up our state-of-the-art Kenilworth Medical Plaza as a destination center for the best specialty care in the country, and announcing the location of our second Wake Forest School of Medicine campus right in the heart of Charlotte. And now, today, I am thrilled to share that Atrium Health is launching the largest philanthropic campaign in the history of Charlotte and the region that we serve. Philanthropy has always played a significant role in Atrium Health's transformation into a nationally leading health system. In fact, philanthropy goes all the way back to our roots, when the citizens of Charlotte came together to build a hospital from the ashes of the Great Depression to better meet the needs of our community. And here's just a little history for you. When opening Charlotte Memorial Hospital in 1940, our founders followed in the practice of America's early settlers, who, when erecting a building for public use, would set aside a few days for community members to gather and build together. In that same manner, our founders believed in community giving, asking everyone at the time to contribute a minimum gift of $1 per month or the price of a postage stamp today. As the old proverb says, many hands make for light work. And it is in the same spirit of collaboration and contribution which we draw upon today. From Charlotte Memorial 80 years ago to a 42 hospital system today, we yet again endeavor to reinvent ourselves as an organization that not only cares, but educates, that not only innovates, but impacts, that not only leads, but transforms. That is why for the past 2 years, Atrium Health has been quietly shaping this comprehensive philanthropic campaign, recruiting volunteer leaders who have stepped up behind the scenes to lend their time, their talent, and their resources and serve as advocates in our community. Now more than ever, we're committed to ushering in a new era of health and driving a collective vision towards a brighter future ahead for the patients and communities we humbly serve. In fact, our community is counting on us to do just that. And to support this vision, today we make history by launching Giving Hope, the campaign for Atrium Health, with the goal of working together to raise $500 million, whereby every dollar will be dedicated to improving the health and well-being for all. This campaign will also invest in our region's greatest needs, addressing social impact, advances in technology and resources, and research, and healthcare accessibility, creating long-lasting impact that will benefit generations to come. Our campaign, our vision for a brighter future, will be based on 4 pillars: healthy communities, outstanding education, preeminent research, and exemplary facilities. But above all, this is an investment in hope. To paraphrase Helen Keller, nothing can be done without hope. Optimism is the faith that leads to achievement and confidence. And hope for a better future for everyone is in everything that we do. It is written into our mission to improve health, to elevate hope, and to advance healing for all. And it is what drives us to defy all odds and devote ourselves to every hand that we hold and every life that we touch. Yet we cannot do this alone. Everyone can play a role in giving hope. Just ask yourself, what drives your passion for healthcare? What gives you hope for the future? Maybe it's a clinical research trial that finds the cure for a rare pediatric cancer, or innovative medical education that inspires a young disadvantaged kid from a poor family to become a neurosurgeon, or even new patient-centered facilities that help a grandmother of 8 be able to play on the ground with her grandbabies once more after hip replacement. Whatever it is, every bit of support, whether grand or small, will move us closer to our aspiring goal. Hope is in all of our hands. Together, we will make big discoveries. Together, we will recruit the brightest talent. Together, we will boldly expand into the future. And together, we will build a stronger and more inclusive, and most importantly, a healthier community for the benefit of all. Thank you.
Hope. It's the most powerful of all human feelings. With hope, you can do anything. Hope can make the impossible possible. It shines light into darkness, brings joy to the weary, and gives a voice to those who need it most. Hope is at the center of everything we do. Our plan is to transform the lives of people we serve by helping to bring healthier communities, outstanding education, preeminent research, and exemplary facilities. With your help, the future can be brighter than ever. A healthier community starts with fulfilling basic needs. That's why we're investing in affordable housing and food relief programs. It also means expanding access to world-class institutes and taking our initiatives into the communities where they are needed most. Mobile testing and vaccine units, state-of-the-art virtual care, and our groundbreaking hospital-at-home program are just a few ways we're ensuring that no corner of the community is out of reach. We will help cultivate top medical talent right here in our backyard. Through the new Wake Forest School of Medicine Charlotte, Atrium Health will develop facilities and programs for the next generation, creating a diverse learning healthcare system. We will build upon the robust, nationally renowned graduate programs offered today. They'll include more innovative and strategic residencies and fellowships to attract highly trained and compassionate professionals. Breakthroughs can happen anywhere. From our leading-edge translational research labs where we explore basic science, to clinical trials that push the forefront of medicine, and operating rooms where we are pioneering the most innovative surgical techniques. What we learn today enables what we can do tomorrow. From bench to bedside, we are making discoveries that will benefit patients now and for generations to come. Atrium Health will continue creating the best environment to deliver world-class patient care. That means adopting new technologies and equipment to create state-of-the-art spaces to accommodate patient growth and streamlining access to services throughout the region. Our new and newly renovated facilities will be distinctive, consumer-focused, innovative, and provide an exceptional level of care to every community they touch. We're in a time of great change. our population is growing exponentially, and healthcare innovations and delivery models are constantly evolving. This creates a great challenge and an even greater opportunity. We are committed to ensuring that every patient has access to convenient, affordable, quality care. That's why we're starting the largest comprehensive philanthropic campaign in Charlotte's history. It's a monumental goal, but it's the greatest endeavors that create the biggest impacts. And now, it's our chance to give hope to millions of people across the nation. We have an unprecedented opportunity to make a life-changing difference, not just in our lives, but in our children's lives and their children's lives. And together with your help, there's no limit to the health, hope, and healing we can bring to all.
Hello, I'm Hugh McCall, and I'm proud to be leading the kickoff for the Giving Hope campaign for Atrium Health. Now, as you've heard, this campaign will be broad in scope, and there's an opportunity for everyone in the community to get involved. No matter your area of interest, children's, cancer, heart, behavioral health, and so much more, this is a comprehensive effort, and it's a once-in-a-lifetime endeavor for our city. This ambitious campaign will make an impact for the next 50-plus years. Together, we'll strengthen our community as we address the needs of the underserved. We will transform facilities and take research and education to the next level. It's an investment of time, talent, and resources, and it's an investment this community deserves. I've been involved with this health system for many years, witnessed its growth and shared in its vision and mission of giving hope to all. Today, we embark on a new opportunity to build a brighter, healthier future for this community. Thank you. And now please welcome Ed Brown, Chairman of the Board of Commissioners for Atrium Health.
So as I think about Atrium Health, there are three areas that are extremely important. The first is having an outstanding strategic plan. Gene Woods, our CEO, has done an outstanding job of developing that plan, working with his team. Next, you have to have the leadership team to execute it. He, again, has done an outstanding job of developing and expanding his leadership team to be able to execute the strategic plan. Lastly, you need capital to be able to do that. And so we're very fortunate where we are today in that we have substantial capital. However, the more capital we can raise from this campaign will enable us to accelerate the achievement of our strategic plan. And let's take a look at some historical examples. So the Children's Hospital. When we were thinking about a children's hospital, we actually did not have the money to be able to do it in the time period that we wanted to do it. And so reaching out and raising the money to be able to do that, and the Levine family stepped up and was the catalyst for that campaign. We were able to build the Children's Hospital, and look where it is today. I think we received 8 outstanding awards this past year. So a campaign enables us to accelerate our vision. Then we take a look at cancer. Multiple campaigns, again, the Levine family stepped up, and we were able to invest significant dollars ahead of schedule because of the campaign funds that we received. So as we take a look at ourselves today, there are many areas such as pulmonary where we want to make investments. Additionally, technology is moving so rapidly that this campaign will enable us to accelerate our investment in those areas as well. So this campaign is critical, is absolutely critical to the achievement of our strategic vision in the time frame that we want to achieve that.
Good afternoon. I'm Julie Freischlag, CEO of Wake Forest Baptist Health, Dean of Wake Forest School of Medicine, and Chief Academic Officer of Atrium Health Enterprise. It's exciting to be part of another milestone in our journey with Atrium Health. I'm joined by Lisa Marshall, our Chief Philanthropy Officer at Wake Forest Baptist Health, and it's truly a day of celebration. And Lisa and I, along with many others, are celebrating the opportunity to be together after many months now that we're vaccinated.
It is really great to be vaccinated and be together.
The Giving Hope campaign is so important for the future health, growth, and vibrancy of Charlotte, Winston-Salem, and our entire region. The health, social, and economic challenges our communities face are real, and we have an incredible opportunity to make a difference by bringing together our clinical and academic excellence, advancing innovation and discovery, and investing in our communities. To echo Ed Brown's comments, this campaign will help us accelerate the pace of healthcare innovation and bring new treatments and technologies to patients in half the time. It will also help us become together the largest medical educator in the state as we extend Wake Forest School of Medicine to include a second campus in Charlotte. Together, we will educate nearly 3,200 learners across more than 100 specialized programs each year. And we will create one of the nation's most diverse student bodies and reduce the shortage of doctors in North Carolina. When we break ground on our Wake Forest School of Medicine Charlotte campus, we'll need you. There are so many ways to provide support, from gifts for capital projects and distinguished faculty chair positions, to scholarship funding for medical students, residents, fellows, and undergraduates. With your support, we intend to become a nationally ranked top 10 medical research center, elevating North Carolina as a national destination for medical care. We will advance discoveries and develop treatments from bench to bedside that improve health today and for generations to come. Together, we can establish healthier communities. We can reduce disparities in care and reach even more patients closer to home through telehealth, community investment, and enhanced care. Through this Giving Hope campaign, together we have the unique opportunity to be part of the compassion, inclusion, and commitment that are at the heart of medicine and the care we give our patients and communities every day. I hope you'll join us.
Well, thank you very much for those comments, Julie. As Julie mentioned, I'm Lisa Marshall, Chief Philanthropy Officer at Wake Forest Baptist Health. It's so true that community support and philanthropy make an incredible difference. In Winston-Salem, we have seen this firsthand with our health system growing by leaps and bounds over the past 5 years. The recent opening of our birth center and the fully renovated Dale and Karen Sissel Neonatal Intensive Care Unit is a great example of how our partnership with community members is advancing healthcare in our community. And we are excited to continue investing in our patients and communities. Let's talk about some examples of those investments. Generous commitments from Wake Forest Baptist, Atrium Health, and loyal donors are helping us advance a new eye institute in Winston-Salem. And plans are underway for a state-of-the-art care tower, as well as a new children's outpatient center in the Triad. As is the case with the Giving Hope campaign in Charlotte, here in Winston-Salem, our local philanthropic partners and supporters will continue to play a key role in bringing all of these projects to life, ultimately raising the bar for treatment across our region. And today, we come together to celebrate the Giving Hope campaign and this exciting opportunity with the second campus of Wake Forest School of Medicine. We will continue to grow support locally as our school and our healthcare footprint grows. Donations to the new campus will help transform medical education in Charlotte, while also having a very positive ripple effect in Winston-Salem and beyond. This campaign really does touch all of our communities. Funding will enhance care for patients across our entire region. It will also enable us to recruit and retain the best, brightest, most diverse talent and educate next generation medical leaders who deliver exceptional care to all we serve. We can each make a difference in the future health and growth of our communities. Thank you for giving hope together with us.
I have hope for our patients here at Levine Children's Hospital because we offer all of the novel clinical trials that are available in the country. We offer top-notch family-centered care, and all of that is really done by our community support as well as Atrium Health support.
I am hopeful because our community stands behind Project Pink and patients like me.
El Hospital de Levine Children's me ha ayudado bastante.
I'm Julie Freischlag, and I'm giving hope for the future of medical education and research. We have an incredible opportunity to advance next-generation training, innovation, and discovery, and improved health for all in our community.
I have hope because of the community support for Atrium Health that Hope Health Healing will be available for all.
We're cheering on Atrium as they move forward to give hope to our community.
Atrium Health has always given me hope because of the safety that they provide to the patients in the community, as well as their cutting-edge innovations and procedures, and they're always looking for something new.
Atrium Health gives me hope by offering one-of-a-kind medical education programs to create the next generation of medical professionals.
What gives me hope is the great difference this campaign will make, not only for my health, but for the health of my grandchildren.
Hi, I'm Greg Olson, and Atrium Health gave my family hope when we needed it the most. And now, through this Giving Hope campaign, families like myself are going to try to galvanize the community to continue to expand access and quality of healthcare here across the region through the Giving Hope campaign.
I think it's extremely important that the community sees themselves in the people that's caring for them, and Atrium Health is doing an amazing job of educating its students and giving us hope.
The donors and community who stand behind Levine Children's Hospital give us hope that Emmett will continue to grow and live every day to the fullest.
My name is Gene Woods. I'm the president and CEO of Atrium Health, and I'm all about giving hope.
Buenas tardes. Good afternoon. I am Armando Chartier, president of Atrium Health Foundation. When my family arrived in this country as refugees from Cuba, I was just 11 years old. We came seeking hope for a better future and a better life. I have to say that seeing those faces of hope certainly inspires me and reflects our commitment to the for all part of our mission. This is a long-awaited day for Atrium Health Foundation. As Mandy and Jean both mentioned, there's been a tremendous amount of work behind the scenes. And I just can't thank enough our campaign leaders and team for getting us to this point. With their dedication and generous support from the community, we've already raised over $75 million towards our goal. A portion of this total includes a scholarship endowment that was established in honor of Bishop George E. Battle Jr., a former Atrium Health board member and a lifelong advocate for the economically disadvantaged. These scholarships will support the continuing education of those who live in underserved communities and are pursuing a degree in health sciences. This is just one example that underscores our desire to make a social impact and to invest in a diverse group of learners who truly reflect the community we serve. We're excited about the opportunities ahead. As you've heard today, there's a great need to build a healthier community, to address disparities, modernize facilities, and to take our research and academics to a whole new level. And Atrium Health is stepping up in a significant way to address these needs. With philanthropic support, we'll see a new medical school on the horizon and development of other new facilities and programs that otherwise would not exist. I hope our enthusiasm is contagious. We want everyone in the community to know that you can join us in this journey. From the children who raise money at neighborhood lemonade stands, and you know who you are, to the individuals who support a scholarship, the family who underwrites a new medical program or facility, to the foundations and corporations that are funding cutting-edge research in our social impact strategy. Every dollar makes a difference. One of my favorite sayings is the rising tide lifts all boats. Well, the teal tide is rising. We hope you'll ride this momentum with us. Together, we can give hope for a brighter future for all. Thank you for joining us today, and thank you in advance for your support.